Hi, my name is Sarah Perry. I'm an advanced practice RN student. I'm going for acute care nurse practitioner, and this is for my course for rural development. I'm going to be conducting an interview with Chetna. She is an acute care nurse practitioner in the medical intensive care at St. Elizabeth's. So Chetna, can you just tell me a little bit about yourself?
Hi, I'm Chetna. I'm an acute care NP for the last 3 years. I went to Kent State for my master's school. My undergraduate bachelor was at Youngstown State University. I've been doing acute care for the past 3 years. It is a challenging position, but I love it and I enjoy it a lot.
So I know you currently are working in intensive care. Can you kind of go into a little bit more detail about what you do on a day-to-day basis as a role as a nurse practitioner in the ICU?
So as an ICU NP, you have a lot of autonomy. You have to gain a lot of trust, and you have to stay up to date. You have to do a lot of resources, like for a lot of diagnoses and treatments. Basically, I come in, get my report. I have 10 patients. I round on those 10 patients. Create a plan for them for those days. If I have to run into a situation where I need to do procedures, I do place central lines, 8 lines. I have done intubations along with the physician, have placed temporary dialysis catheter as well. In a situation where we need to put procedures, if we need the procedures for the patient. So I see the patient, then I round with the doctors, kind of go over patient's history, current condition, what's going on, what they're on, what our treatment plan is, and kind of work along with each other what we want to achieve. Also, we collaborate with a lot of physicians because we are in acute care setting. We deal with a lot of specialties and kind of work along with them as well, and pretty much basically manage patients that are critically ill.
So have you seen, obviously you've seen an influence in like the acute care advanced practice nurse in healthcare today as you are currently working in, an acute care setting. Have you seen any other advancements as far as like bringing in NPs into acute settings?
Honestly, there are a lot of people who wants to do acute care, but the work is so much, they kind of get intimidated and go into other specialties. So honestly, there's a lot of shortage in acute care settings, and a lot of facilities want experienced people, so it makes it harder for NP to get a job too. And I think that because of that, there's a lack of, lack of advancement in acute care setting for NPs.
Awesome. On top of that, are there any other barriers that you've seen, not necessarily just in acute care, but for advanced practices in general?
Well, it's something if you want to do it, like I think if you have the will to do it, yes, I have seen a lot of NPs that said I enjoy bedside nursing better than acute care because the workload is less, but as an acute care NP, you're responsible and your workload is really, really high. And you have a lot of responsibility towards your patient, also a lot of collaboration with their physician, and sometimes that can be intimidated by a lot of the NPs. And for that reason, there is a lot of lack of NPs wanting to do this kind of work.
Awesome. What changes would you like to see made for advanced practice nurses?
I mean, obviously, autonomy is big. Working independently is big, but that all comes with experience. There's days I feel like I could do more procedures, or, able to do even further, with critical care setting as I get more comfortable with it. But then I see other new people in here, and then I'm like, oh no, maybe it was made for a right reason, to keep it very limited.
Awesome.
So I'm not 100% sure, but as of now, I'm satisfied with what I'm doing.
Good. And last little thing, any advice for a little NP student?
Well, I kind of motivate you to go back to medical NP school.
She was kind of my inspiration here. So working alongside Chetna has been amazing. She's a great practitioner, and already, the couple times I've been with her, I've learned so much. So here we are.
I think if you want to advance your career, this is the best route to go towards. I think you learn if you want to take that. If you want to be the one to make decisions for your patients, this would be the best route to be in. to give a better care for your patients and able to do things that you feel like that will help improve your patient's condition.
Yeah.
I really think that being acute care NP or an NP in general will grow you independently, mentally, physically, overall, make you feel like you're making a change in your life.
Awesome. Well, thank you so much for sitting and
welcome.
talking with me today. Really
You're
appreciate it. And that is all I have for today. Thank you, guys.